Hello, everybody. It's great to be here one more time today. My name is Gary Fowler. I'm the CEO, president, and founder of GSD Get You Done Venture Studios, a premier AI and quantum venture studio located in the heart of Silicon Valley. I'm a 17-time serial entrepreneur with several unicorns under the belt. I was on the original management team of Click Software, which was sold to Salesforce for $1.35 billion, and also Eva.ai, an AI HR tech company that I co-founded with Dr. David Yang. We believe at GST that intellectual capacity is evenly spread around the world, but opportunities are not. With that, I'd like to introduce my incredible guest. So, Dominic Senn is a serial entrepreneur and experienced startup manager, an excellent communicator and team player with a large network. He's done several startups, the head of business development at Twin AG, Switzerland's most successful provider of mobile payment solutions, co-founder and CEO of Machine MD, which we're going to talk about today, a startup that is developing medical devices that help diagnose brain disorders by looking at the movement of the eyes. Strong focus on conscious leadership and corporate culture. He's proud to be manage a startup that provides a positive impact on the planet, and we sure need that a lot. And his quote is from Ram Dass: "Finally, never forget. They're all just walking each other home." Love that. So with that, I'd like to bring Dominic. Hi, Dominic. How are you today?
Hi, Gary. All good. Thanks. Good to be with you.
Yeah. So tell me a little bit about it. So your journey. So you're in Bern today, correct?
That's right. Bern, Switzerland. Yes.
What's the weather like?
Well, it's a bit gray, to be honest, and starts raining. So it's not the nicest weather here right now. But
Uh,
spring is coming. You can feel it.
the spring's in the air. Do you? I always remember when I watched The Sound of Music. I always wondered, do people really yodel in Switzerland? Is that really? Do they have competitions? They really do it or not?
Yes, they do it. There are competition. But I mean, that's basically maybe one person out of a 10,000 that is doing it. So if you come here as a tourist and you go to the right spots in the mountain, you will see it. But if you just wander around in the city, most likely will not. You will not
That's
see it.
interesting. So tell me a little bit about it. So you've had quite a long journey. You've worked for corporations. You've been been in the business for a long time since 1995, right? You start out. How in the world did you start out as a photographer, by the way?
Well, that was pure coincidence. After high school, I actually wanted to leave Switzerland, and I did go to Mexico without a word of Spanish. And I got there. I found a family that did host me, and I was looking for work, so voluntary work without getting paid. And what I found is a little newspaper, a local one, and they still needed someone making photos. And I mean, since you don't have to speak or understand a lot, that's what I started doing there.
Well, that's amazing. And you how did that affect you finding a family that would host you? Has that affected your worldview of humanity? Has it changed things, or how did it make you feel?
Yeah, I mean, for me, I was 19 at the time, so that changed this whole year or year and a half in Mexico. That changed, I would say, considerably who I am, and even more so if I look back, maybe than I realized at the moment. And I mean, in many ways. So one is, I mean, Switzerland is quite a rich country now, as you all know. Mexico, at least 25, 30 years ago, that was a pretty poor country, and that was maybe in the poorest region there, spending the 1 year. And I mean, this changed a lot. The host family that I had changed a lot. Kind of I mean, these people, how they open the house, they welcome you into their house, they share the food, everything they have, even though maybe they earned a salary which was, I don't know, a tenth or a fifth or whatever of the average salary here in Switzerland. So that was eye-opening for me. And the other thing was certainly kind of just realizing, I mean, the world is not confined to Switzerland. I mean, there are so many other places, they are incredibly different. But you can actually set up a good life there too.
And sometimes people say it's not the people that have the least really have the most. Sometimes,
Yeah.
it's kind of interesting because it's not about the cars you have or the houses you have. It's about who you are, right? And people that opens up, that's an interesting phenomenon. I've seen it too because I've traveled and lived in a lot of different places. Russia, all over Europe. And I found that too. People open up their homes and will try to help you if you ask. Right? It's really interesting. So you did that, and then you did a web design company. What made you decide to do that? Was that located in Switzerland? Was that in Mexico?
No, that was when I was back in Switzerland. I would just when I came back and started studying at university, and this was more. I mean, web technology just started there, and companies and community they started to build their website, and I guess that was part of my entrepreneurial side. Kind of okay, that could be something where I can earn a bit of money on the side while I'm studying. And that's what I've been doing. I mean, that was really a small side project, but it was an interesting one. It was basically my first step in building something on my own.
So how did you go from that then to being the state secretariat for economic affairs?
I mean, I was studying political science and economics at the university in Zurich. And I was more into economics than political science, maybe. So this government part, that was for me super interesting because it was all about kind of how do you regulate the economy in a way that it can function as effective as possible. And that was, I mean, I didn't spend too much time there. That was a couple of months, but that was very insightful. And also kind of my first getting in touch with kind of the state administration from the inside a bit, kind of the mindset of the people that are there. And I was also surprised by the competency. So I met some really, really competent people there. No, I mean, there were also sometimes a bit kind of to the stereotypes that you may have from these type of people. But I mean, many of them, they were the boss I had. I mean, that was I would say one of the most competent people I ever met in my life. And it also felt good that these type of people are actually looking after the Swiss economy. That was a good message to me.
So when you went down through it, so you did that, and then you went over to. How'd you go over to Twin? How did that start? That whole thing with Twin.
Well, I mean, I finished my studies. I started working more into consultancy, policy work, more on the political science side of things. And quickly I realized that's not the path that I want to go down. I did go back to ETH, started a PhD there, and actually was on the track to get the PhD and then eventually a professorship. But I also got my first kid at the time, and then I realized, hey, I will need to travel a lot and relocate to make an academic career, and that was kind of hard because my wife, she had a very good job. She didn't want to move away from Bern, and I was doing work in an office here in Bern with two friends of mine. One was a postdoc also at ETH, the other doing his PhD in physics at ETH. And they all were a bit bored with the work they were doing at the university. And we were always brainstorming, hey, actually, we could start something completely new, the three of us. And that's how we got into the first startup, which we sold after a couple of years. And then there came a second one, which we bootstrapped with another friend of mine.
Well, which one was that? Was that Basis Note?
The first one was Basis Note, yes. The second one that was, or still is, it's still operational and growing. That's Optor. That was an interesting one because we developed a quite impressive optimization engine that we used for roster planning. But we also did all the test planning for the big tunnels here in Switzerland to actually, you need to do 10,000 of tests in order to open up a tunnel. And you need all kinds of material and personnel, and this needs to be optimized in a way you can do it within a few months and not within a few years. So this has been quite an interesting journey. That was also quite a lengthy journey because we didn't get any external money. We didn't look for it. So we did a lot of project work while we were developing the product. And that's when I got in touch with one of the management team at Post Finance. That's one of the biggest retail banks in Switzerland. And they were looking to build a mobile payment application platform themselves, but they didn't have the internal resources because they were changing the core banking system within the Post Finance system. So they realized they need to do like a corporate spin-off there, otherwise that's not going to fly. And these were all purely corporate people, and they looked for someone with more experience from the startup side of things. So I joined, and three people from Post Finance and myself, we started Twint. everyone said that's going to fail because the other big banks like UBS, Credit Suisse, Raiffeisen, and kind of the big one players here in Switzerland, they were not on board. They were our competitors. But finally, we made it. So they had their own initiative, but they got stuck in governance issues because there were so many players at the table. And we were super small. So we were like 12 people. Well, there was a huge external development team on the software side, but we actually, on the business side, it was just like 10, 12 people. And we built a full mobile payment platform within 1.5 years or 2 years and launched it. And then eventually we merged with the other players, and now it's the dominant mobile payment app in Switzerland. I mean, everyone knows it and everyone uses it.
So, as you're going down through the journey and you did that, you built that company, how does it change your opinion of building another company? How did it change? Did you have more confidence, and what was it like? What was the journey like? So once you did Twint, you understood you could go against the competition. How was it going over then to Opter, right?
No, Opter was before. So it was Four Spaces now, then Opter, then Twint, and now Machine MD.
Oh, I see. Okay. But so Opter, I got it because I have it's got it a little bit different in the chronology here. So Opter, then Machine MD, you found it in 2020. What made you decide to do that?
Yeah, I was really looking for a project that has more to give on the impact side of things. So, and there, I mean, the medical space, obviously, that's an interesting one. And I mean, at the end of the day, it was a coincidence. It was Matthias Abeck. He at that time was a professor here at the University Clinic in Bern. He's one of the leading researchers in the space we are active in. He has been doing many, many years of research in his lab there. And he was he realized over the last few years before we started Machine MD that actually what he has been developing for research purposes can be used in clinic, for clinical use with real patients and not just for research. But I mean, he was aware that he needs someone who is able kind of to package this up in a way that this can be built, certified, sold, etc. And he was a good friend of mine. That's how we got in touch. And then I looked into the case. I mean, I liked it a lot from the impact side of things because neurological diseases, it's the leading cause for disability adjusted life years and the loss of those life years. It's one of the leading causes for death. It causes an awful amount of human suffering now for the ones who are concerned, but also for the families.
One of the reasons, the bad part, right? People saw my father had dementia, and I mean the stuff that he had to go through was just unbelievable, right? And
absolutely.
Catching it early and doing things like stem cell treatments to be able to help it, or peptides, right? Other things to be able to help it's important.
Yeah, absolutely. And I mean, one of the problems is always you need to get an early diagnosis, and without diagnostic means you can also not develop any therapies, because in order to develop the therapy, you actually need to capture people at an early stage, and then you can do the clinical trials to actually see if a therapy works or not. So diagnostic is like the foundation of getting people, capturing them, and also eventually being able to treat them. I mean, for quite a few neurological diseases, there are great therapies out there. For many others, it's just emerging and starts to emerge. But without good diagnostics behind it, I mean, you will never end up with a good therapy because you simply don't know to whom you should give it. Or then you give it at the stage where it's already too late. No? And the problem is with the brain, typically damage.
Right? It's too late, right? I mean, most of the problem is it's not that things can't be taken care of. It's too late to be able to do anything about it.
Yeah, absolutely. And I mean, typically, very often with the brain, I mean, there are approaches to actually gain back brain function, but mostly is what you have lost, and you don't regain it in the first few weeks, maybe after stroke or something. It's gone. And that's irreversible now. So actually capturing this at an early stage, that's super important.
So how can you, what kind of things, tell us about Machine MD, what kind of things can you catch? And how, tell us about how exciting this technology is.
Yeah, so we can catch I mean, you have to imagine, we give stimuli into the eyes, and then we capture how the eyes react to those stimuli on the pupil. It's like a software end-to-end test. And what we are checking by doing this test is we look at how well the neurological wiring, which is involved in processing visual signals and steering the eyes, etc., how that works. And this system is very, very well known clinically. I mean, that's not our invention. So if you give a certain stimuli and you do get the wrong response, there is something wrong. No, like a calculator, you do 2 + 2 and you get a 5, it's not working properly. It's a bit like this.
Right.
But the problem is, as these type of exams, there are clinical specialists. They are called neuro-ophthalmologists, but there are just about 800 in the whole world. It takes about 10, 15 years of training to do these type of exams well manually. That's how they're done today. So it's like follow my finger and I'll observe if there are any jerky movements, how your eyes react, for example. That's super hard. So it's not scalable. You can't use it at lower care levels. So if you go to an optician, if you go to your MD or whatever, he will not be capable of doing it. And our goal clearly is to enable whatever care point or touch point there is in the care system where actually people are in touch with, because with those super experts they need to wait 6 months, and most likely don't even go and see one, to enable those care touch points to make these assessments. So for us, the ideal world where we're working towards is you go into your pharmacy, as you measure the blood pressure, you put on a VR headset, you press a button, it tells you, hey, there is a neurological problem, you need to go now and see a neurologist. And then you can take it from there. Now, instead of not realizing it, waiting another 6 months or 2 years or 4 years, whatever it is, and then they discover a brain tumor, but it has grown so big that basically you can't do much about it. And I mean, when it comes to diseases, so the most important ones, that's Alzheimer's, that's Parkinson, that's MS, that's stroke, that's brain tumor. And then you have a long list of rare diseases. But if you add those up, we did that exercise, they are not that rare anymore. No, each one for itself is a rare one, but there is still not a considerable risk that you can get that in your life.
So tell us a little about what stage you're in with the company today.
Yeah, so we have developed the first diagnostic device. We got it certified as a class 2. That's important. It's super regulated, the medical field. In Europe, we have market approval in the US. We started selling the first devices in April last year. We now just entered into a partnership with Topcon. That's one of the leading strategic players in our field, to really push this vision to get these type of exams into primary care, be it opticians, optometrists, MDs, etc. So I would say we are early stage in terms of where the product is and the scaling up on the market side. We are quite advanced. We're quite fast to actually get there, because that's a lot of work if you're in such a regulated space. And we are certainly very well positioned when it comes to how can you build really reliable clinical algorithms based on eye movements that allow you to tell there is a problem or there is not a problem. Because that's, at the end of the day, that's like the holy grail. Because if you say, oh, there could maybe, and you need to counter check with this or that, and you need to have, I mean, once you need to start educating people, it will not scale. So it has to be like a traffic light that basically tells you, oh, okay, no, there seems to be a problem, go and see either an ophthalmologist or a neurologist.
And how accurate are these tests?
Well, I mean, they are super accurate in order to detect problems that you have in the brain. The tricky part is to combine them in a way that we don't flag too many false positives. Because, I mean, you can always have something that is not clearly out of the norm, that is a bit strange. But I mean, people are very different. No? So there are many people, if you do a brain scan, you see all kinds of things now, but that doesn't mean that they have a malign brain tumor or whatever it could look like, but it's actually not the case. So you don't need to do anything clinically. And this is the tricky part, to actually classify people that need to go and see a neurologist against people that might have, I don't know, like a strange pupil reaction, or you see maybe in the brainstem things are not perfectly the way they should be, but it's clinically speaking, it's not a real problem.
It's interesting, and so how does it look? I mean, we hear a lot about other technologies like this that are out there that are looking at the eyes. It sounds like the eyes are the gateway. Some cultures say the gateway to the soul, but really the gateway to our health.
Yeah, absolutely. I mean, the eyes are actually, I mean, for many reasons. No, you can look at the eyes from two dimensions or angles. One is you look op- optically into the eye at the retina, and the retinal cells, these are brain cells. So that's the only part of the brain you can actually look at without drilling a hole in your skull or in your head. So there is a lot of super interesting technology when it comes to imaging, and these devices, they're out there since many years now, and every ophthalmologist has those, to look at the retina and then to analyze those images with AI algorithms in order to detect, for example, that you have blood vessels that look suspicious. That can be an indication of cardiovascular disease. You see with Alzheimer patients, you see certain protein structures, etc., that are there that are indicative that you could get Alzheimer's or already have Alzheimer's, maybe. So there are ways basically the eyes are like you can look into the brain, so to say. And the other thing that we are doing is, since the neurological wiring is taking up so much space in the brain, so it goes from the cerebellum, the brainstem, the visual cortex, the chiasma. So it's basically traveling through we don't realize it now because there's no conscious around it, but like 40-50% of the brain is actually constantly involved in processing visual signals and steering our eyes. And if there is anything wrong, you can detect this based on how the eyes and pupils react to certain stimuli, so on the functional measurement. And I mean, eventually, I strongly believe these two approaches, they will go together now in order to build really strong predictive models. You need to know what the structure looks like, and you need to know what works and what does not work. And if you combine these two types of information, then you can really say a lot about your brain health.
What else can be looked at? So if you're looking at the brain, what else? How far down can it go? Like not just the brain health. Can it look at like liver problems? Are there colors of the eyes that change? Those kind of things. Are there other diseases that are not just neurological diseases that this thing can find that gives us that gateway into our health?
Yeah, I mean, I think that the most important parts of our health you can look at, that's cardiovascular, and that's neurological. I mean, I don't know. I'm not a clinician myself, so I don't know if you have liver problems, for example, if that has an impact on your cardiovascular health too, and then this one could be spotted. That can well be the case. I don't know if you have liver problems, if that affects to some degree your brain functioning. If it does, that could be detected too. But I think if you think about kind of cardiovascular problems and neurological problems as, I would say, maybe the two biggest medical problems and health issues we have now, then the eyes are a great gateway to actually collect in a very fast, non-invasive, complete risk-free way a lot of information. And you can do this super fast on a continuous basis. You can also track it over time personally. So that offers a lot of advantages compared to how diagnostics are done today, where you basically need to do all kinds of different tests when it comes to neurological diagnostics. I mean, then the gold standard clearly is you take an MRI, but I mean, that's not affordable for most people. It's expensive. There are long waiting times, and you're not going to do it, or we are not capable, our health system, to provide this on an ongoing basis every 3 years to everyone. No, it's simply we can't pay for it. It's too expensive. But what we are offering, basically, you could think like, okay, you're going to do a check every year.
Well, you look at it, that's part of the problem, right? It's not democratized. There's not equal opportunity. So the
Yeah.
more we have technology, just like Machine MD, the greater the probability that people are going to be able to, no matter where they are, to be able to check their health so they can get stuff down. It's not about waiting. It's about getting it done. So we're coming up to the top of the show, Dominic. Closing thoughts, and how do people get a hold of you?
Well, they can send me a LinkedIn message. You can also drop me an email. That's Dominic with the C at the end .senn@machinemd.com. Always happy to connect. And my closing thoughts are really, I strongly believe that we can leverage technology here to improve the way people are diagnosed, and then hopefully also for those diseases where we don't have good therapies to also get to those therapies very quickly.
You remember, we talk about it. For all you startups out there, it's about getting your Ferrari out of the garage. Don't keep it in the garage. You got to get it out. And it's not just driving around the neighborhood. It's winning Formula One. So get that car out of the garage, get the operational expertise, the access to capital, network, and contacts. And our theory is that any company can become a unicorn because you can pivot to success. You've done a great job. The Ferrari's coming out of the garage, Dominic. It's good to see you today. And thanks to all my audience for joining one more time. GSD Presents Silicon Valley AI and Tech. My name is Gary Fowler, and I'm your host. Stay happy, stay safe, and stay healthy. And I'll be back to you again soon with another exciting edition. Thanks, Dominic, and thanks, everyone.
Thank you, Gary.